Understanding impetigo, a common skin infection. Impetigo is a common skin infection that primarily affects the outer layers of the skin. It is caused by bacteria, most commonly Staphylococcus aureus or Streptococcus pyogenes. These bacteria can enter the skin through minor cuts, insect bites, or other breaks in the skin. It's highly contagious, meaning it spreads easily from person to person. This can happen through direct contact with an infected person, or by touching objects and surfaces that have been contaminated with the bacteria. This infection mainly affects infants and young children, especially those in close contact settings like schools and daycare centers. However, it can also affect adults, particularly those with weakened immune systems or existing skin conditions. Impetigo causes sores on the skin, often around the nose and mouth. These sores start as red spots and quickly develop into blisters that can burst, leaving a yellowish crust. These sores can be itchy and uncomfortable, leading to scratching that can further spread the infection to other parts of the body or to other people. There are two main types of impetigo, non-bullous and bullous. Each type has distinct characteristics and may require different approaches to treatment. Non-bullous impetigo is the most common type. It features small red sores that burst and ooze, eventually forming a honey-colored crust. This type is usually less severe but can still be quite uncomfortable. The progression of non-bullous impetigo involves the red sores bursting and oozing, which can spread the bacteria to other areas of the skin or to other individuals. Bullous impetigo involves larger blisters filled with fluid. These blisters can be more painful and are more likely to affect the trunk of the body. They can also burst, leading to larger areas of raw skin that are susceptible to secondary infections. Impetigo is treatable with antibiotics, which can be administered either topically or orally depending on the severity of the infection. It's important to complete the full course of antibiotics to ensure the infection is fully eradicated. Understanding this infection is crucial for parents and caregivers. Knowing the signs and symptoms can lead to early detection and prompt treatment, which can prevent the infection from spreading and reduce the risk of complications. Early detection and proper care can prevent complications. This includes keeping the infected area clean, covering it with a bandage to prevent scratching, and ensuring the child avoids close contact with others until the infection is no longer contagious. Regular hand washing and good hygiene practices are also essential in preventing the spread of impetigo. Causes of impetigo bacteria and transmission. Two types of bacteria primarily cause impetigo: Staphylococcus aureus and group A Streptococcus. These bacteria thrive on the skin. They can enter the body through cuts, scrapes, or insect bites. Even minor skin irritations like eczema can provide an entry point. Impetigo spreads easily through close contact. Touching an infected person's sores transmits the bacteria. Sharing personal items like towels, toys, or clothing can also spread the infection. Recognizing impetigo symptoms and types. Impetigo is a common and highly contagious skin infection that primarily affects infants and young children. Understanding its symptoms and types is crucial for timely and effective treatment. Recognizing impetigo symptoms is vital for early treatment. Early detection can prevent the infection from spreading to other parts of the body or to other individuals. The infection usually starts with red sores. These sores can appear anywhere on the body but are most commonly found on the face, especially around the nose and mouth. These sores quickly rupture and ooze fluid. The fluid is typically clear or slightly yellowish and can be quite contagious. A honey-colored crust then forms over the sores. This crust is a hallmark of impetigo and helps in distinguishing it from other skin conditions. Non-bullous impetigo is characterized by smaller sores, often clustered around the nose and mouth. These sores can spread to other areas through scratching or contact with the fluid. These sores can be itchy and may cause discomfort. Scratching can lead to further infection and spreading of the bacteria. Bullous impetigo presents with larger, fluid-filled blisters. These blisters are more resilient and take longer to rupture compared to the sores in non-bullous impetigo. These blisters are more common in infants and can appear anywhere on the body. They are often found on the torso, arms, and legs, and can cause significant discomfort for the affected child. Treatment for impetigo typically involves topical or oral antibiotics, depending on the severity of the infection. Early intervention can lead to quicker recovery and reduce the risk of complications. Preventive measures include maintaining good hygiene, such as regular hand washing and keeping wounds clean and covered. This can help prevent the spread of impetigo to others. With proper treatment and care, children can recover fully from impetigo and return to their normal activities without any lasting effects. Recognizing the symptoms early and seeking medical advice is key to managing this common skin infection effectively. Impetigo in infants, a cause for concern. Infants are highly susceptible to impetigo. Their immune systems are still developing, making them more vulnerable to infections. Infants also have thinner, more delicate skin, making it easier for bacteria to penetrate. Impetigo outbreaks are common in daycare settings. Infants in close contact are more likely to spread the infection. Early diagnosis and treatment are crucial for infants. Parents and caregivers should watch for symptoms. Prompt medical attention can prevent complications. Diagnosing impetigo usually involves a visual examination by a doctor. The doctor will assess the appearance of the sores and ask about the child's medical history. In some cases, a sample from the sores may be taken. This helps identify the specific bacteria causing the infection. Knowing the type of bacteria is important for treatment. It helps doctors choose the most effective antibiotics. Early diagnosis and treatment can prevent the infection from spreading and minimize complications. Section 6. Treatment options for impetigo, topical and oral antibiotics. Antibiotics are the primary treatment for impetigo. This bacterial skin infection can cause red sores that can burst and develop honey-colored crusts. It's highly contagious, so prompt treatment is essential to prevent its spread. The type of antibiotic prescribed depends on the severity of the infection. Doctors will assess the extent of the sores and whether the infection has spread to other parts of the body. They may also consider the patient's medical history and any potential allergies to medications. For mild cases, topical antibiotics, applied directly to the sores, may be sufficient. These creams or ointments work by killing the bacteria on the surface of the skin, helping to clear up the infection and reduce symptoms like itching and pain. More severe cases may require oral antibiotics. These are systemic treatments that work throughout the body to fight the infection from within. Oral antibiotics are particularly useful if the impetigo has spread, or if the patient has multiple sores. These are taken by mouth, usually in the form of pills or liquid. It's important to follow the dosage instructions carefully to ensure the medication is effective. It's crucial to complete the full course of antibiotics as prescribed by the doctor, even if the sores start to clear up. Stopping the medication early can lead to a resurgence of the infection and contribute to the development of antibiotic-resistant bacteria. This helps ensure the infection is completely eradicated and reduces the risk of antibiotic resistance. Antibiotic resistance is a growing concern worldwide, making it harder to treat common infections. By taking the full course of antibiotics, patients can help prevent this serious issue. Follow-up appointments with the healthcare provider are also important. These visits allow the doctor to monitor the patient's progress and make any necessary adjustments to the treatment plan. If the infection does not improve or worsens, the doctor may need to prescribe a different antibiotic or additional treatments. In addition to taking antibiotics, practicing good hygiene is essential in managing and preventing impetigo. Regular hand washing, keeping the infected area clean, and avoiding sharing personal items like towels can help reduce the spread of the infection. Family members and close contacts should also be cautious to avoid contracting the infection. Keeping the infected person's items separate and disinfecting common surfaces can help protect others from impetigo. Education about impetigo and its treatment is key. Healthcare providers often provide informational materials to help patients understand their condition and the importance of following the treatment regimen. This knowledge empowers patients to take an active role in their recovery and prevent future infections. With proper treatment and care, most cases of impetigo resolve without complications. Patients can look forward to clear skin and a return to normal activities once the infection is fully treated. Section 7. Preventing impetigo, hygiene is key. Preventing impetigo involves practicing good hygiene. Regular hand washing with soap and water is essential. This helps remove bacteria from the skin. Teach children to wash their hands frequently, especially after using the bathroom and before eating. Keep the infected area clean and covered with a bandage. This helps prevent the spread of bacteria. Avoid sharing personal items like towels, washcloths, and toys. Section 8. Controlling the spread practical tips. Controlling the spread of impetigo requires vigilance. Wash contaminated items such as clothing, towels, and bedding in hot water. This helps kill any bacteria present. Disinfect frequently touched surfaces like doorknobs and toys. Keep children with Impetigo home from school or daycare until the sores have crusted over, or the doctor advises it's safe to return. This helps prevent the spread of the infection to others. Section 9. Conclusion. Understanding for effective management. Impetigo is a common and treatable skin infection. Understanding its causes, symptoms, and treatment options is crucial for effective management. By practicing good hygiene, seeking prompt medical attention, and following treatment guidelines, we can effectively prevent and control the spread of Impetigo. Remember, early detection and proper care are key to a good prognosis for affected individuals.
Thanks for watching. Please like, share, and subscribe. And remember to click the notification bell to know when future videos are released.